morning, everyone. Welcome to Meet the Experts. My name is Amanda Pearson. I'm a patient and family specialist here in the Patient Library and Welcome Center. We present these sessions each Tuesday and Wednesday at 10 a.m. And today's topic is on From Genes to Treatment with Precision Medicine at Moffitt. Before we get started, we have a quick disclaimer. The content of this presentation is not intended to be medical advice, and the viewer should consult their physician should they have any questions. Viewers should not rely on information contained in this presentation for immediate or urgent medical needs. And if you think you might be having a medical emergency, call your physician, go to the nearest emergency department, or call 911 immediately. Never disregard professional medical advice or delay seeking care because of information in this presentation. And with that, it's my pleasure to introduce our speakers today, Dr. Walko and Paige Parkinson from the Precision Medicine Program here at Moffitt. So welcome, Dr. Walko and Paige.
Thank you so much. It is such an honor to be here, and I also thank Paige so much for really being, I think, the fire that initiated this process for us to speak to you. And we will do a little bit more of an introduction as we kind of get to our team. But again, I really want to welcome everyone for joining us. And what we wanted to talk about today was to share what we do kind of behind the scenes with precision medicine at Moffitt so that you're aware of it, and then also to make sure that we leave time for your questions because we definitely want to make sure that you get out of this what you are hoping to, and also provide you additional information. So I wanted to start with the defining really what precision medicine means, and that can mean something different to a lot of different people in different areas of medicine. The way that we look at it is that precision medicine, sometimes called personalized medicine, is an innovative approach to healthcare that really considers how differences in genetic makeup can influence response to medications. Testing for genetic alterations can help your healthcare team choose appropriate treatment options for you. We have several different types of genetic information, and depending on the type of cancer that you or your family member or friend may have, you may have all of these options employed as part of your care, or just some of them to help answer certain questions. So, what type of genetic information do we typically utilize in managing cancer in general? We have germline testing. This looks at the genetics with which you were born, and this is typically a blood specimen or a cheek swab. If anyone has done sometimes I hear a lot of people talking about getting their pet DNA tested. If you've ever done that, you kind of just try to shove it in their mouth and grab some of the cheek. And that's a great way for us to get DNA, and we are able to again look at the genetics that are in all of the healthy cells in your body. And then we have somatic or tumor testing. And this looks at the genetic changes within the tumor or the cancer. And it tries to answer the question of why did a healthy cell become a cancer cell? And we can do this in a few different ways. So some of the time, if you have a biopsy taken or undergo a surgery where we have a part of the tumor taken out, we can send that tumor tissue for genetic testing. We can also sometimes take a blood sample. And I will say too, if someone has a blood cancer, kind of the tumor is in the blood, so we would be taking a blood specimen, though sometimes we take lymph nodes. But really what we're looking at is trying to get a piece of the tumor to look at, again, why did these healthy cells become cancer cells? So getting a little bit more detailed, what germline testing can help us answer is twofold. So number one, we can find out if you or your family have a higher risk for cancer, or there's kind of an inherited reason why you may have developed cancer or you may have a higher risk. So we do this type of testing in people who have cancer as well as who may be at higher risk for developing cancer. And some examples that you may have heard of are the breast cancer genes, BRCA1 or BRCA2, that are related to breast cancer, pancreatic cancer, ovarian cancer, prostate cancer. There are different genes that are related to colon cancer. And some of the time, these can help us identify targeted therapies. But really, what we're looking for is could this explain why you may have gotten the cancer, or if it runs in your family and we may need to do or discuss increase screening. Sometimes there are surgery options. Those decisions are very individualized based on the gene and your own wishes. Um, our team does not specifically um, do that type of testing, though we interact with some of the results sometime. We have a whole team of genetic counselors who, whenever there is a chance that germline, I'm sorry, hereditary genes may be at play, you would talk to a genetic counselor who would help to talk you through whether or not this would be a helpful form of testing. And then also, if other people in your family have questions and who may also want to consider testing. So that is our wonderful genetic counseling group. And so those questions and what they work with is under kind of that umbrella. Um, for the other type of germline testing that our team is involved with is looking at genes that are involved in how certain medications can get activated, so turned on or turned off. And this can really help. We need these drugs to turn on so that they have effect in your body and do what they are meant to do. However, if they can't turn off, then that can increase the risk of toxicity. So this can really help decide if this is the right drug for you, and then the dose that you may need based on how your body is handling a particular drug. One common example is there is a gene called DPYD, and it breaks down a drug called fluorouracil and capecitabine. These are drugs that are used very commonly in colon cancers, certain GI cancers, sometimes in breast cancer and some other cancers. And so your doctor may decide that if you are considering that drug therapy, that DPYD testing would be appropriate so that we can see how your body is going to handle the drug and if we need to change the dose. And so we have two specialists on our precision medicine team that I'll virtually introduce you to. We have a slide with everyone on there so you can see the team behind the scenes. And they review the results and then will inform your medical team about your risk based on the specific drug that you're getting and the gene that may be associated with it. So, the third type of genetic testing that we do is the somatic tumor-based testing. So again, we're really looking at why did these healthy cells become cancer cells? What genes got turned on? What genes may have gotten turned off? And then more so, what can we do about it? And the what can we do about it falls into a lot of different categories. It can certainly help us find helpful treatment options, and these typically fall into one of three categories. So we have on-label therapies. These are drugs that are approved for a particular genetic alteration in the particular cancer that you or your family member or friend may have. Off-label therapies, so an on-label therapy, this means that it's in the package insert for the drug, it's in the guidelines, it is a standard of care. It's gone through all the testing to be a standard of care option. Off-label therapies are treatments that are FDA approved, but for different indications. And we utilize these a lot for certain types of cancers, including some of the rarer cancers. I am very privileged to work with some of the less common cancers, and just means that the cancer is less common, and sometimes the genetic alterations are less common. And so doing the clinical trials can be more difficult, but we know that the drug likely works. It's just we may not have a randomized controlled trial because that would be very difficult to do. But we know that a particular drug may target a particular gene that is altered in your cancer. And so weighing the risk and the benefit and having that discussion with your physician and you may decide that an off-label therapy is a treatment option that you would want to consider. Now, this can be a little difficult at times because these drugs are expensive. And how we get it to you can sometimes be a challenge. One thing that our team also does, and that Paige is very involved with, is whenever one of these off-label therapies, when you and your treatment team decide that this is the best option for you, the prescription is sent to the pharmacy, or if it's an IV drug, it goes through a different pathway. And a lot of the time, the insurance companies don't want to pay for it because it's not an FDA approved option. So our team works with the specialty pharmacy and will go through the appeal process to show that yes, there is data and that what we are recommending is scientifically supported. And then based on your insurance company, then some of them do get approved, some of them do not, and then we have a few other ways that we can go directly to the manufacturer and a few other things that get handled by our wonderful individuals at the specialty pharmacy. But that is something that we do behind the scenes when off-label therapy is deemed to be a treatment option. And then finally, and very importantly, clinical trials. We have a lot of clinical trials that are biomarker driven. So the genetic alterations that you have in your tumor may make a certain drug one that we want to try to utilize or try to see if it's going to help. And clinical trials can be early stage where we have a brand new drug, or they may be later and we're comparing it to the standard of care. They may also be for early stage cancers. They may be for later stage cancers. And I believe that I know that there is another Ask the Experts that is focused on clinical trials and the different types of trials that are out there that can probably answer some additional questions. But matching to clinical trials and giving you the options that are available at Moffitt, as well as in the surrounding areas, depending on the type of alteration in the trials that may be available is also a big piece of what we try to do. And then one of the other things that tumor testing can help us answer is it can give information about disease outcomes in some situations. Not every genetic alteration is something that we can necessarily target with a drug. However, it may tell us if the cancer is going to be more aggressive or less aggressive. And there's some really, really exciting things going on in certain areas where we're not even just looking at one gene or two genes, but we're looking kind of at the whole genetic landscape using some new technology to try to give you the best prognosis based on the information that we have. And then based on if you have a more aggressive cancer or a less aggressive cancer, this can inform treatment decisions because if you have a less aggressive cancer, we may need to do a different treatment than if you have a more aggressive cancer. So this is just another way that looking at the genetics in the tumor can be really helpful. So just to move into how we kind of take all of these different genetic scenarios and information and translate them into your treatment options. So our precision medicine mission is to seamlessly translate biomarker testing throughout the patient's journey to inform treatment options, including targeted therapies, clinical trial eligibility, and patient safety risk mitigation. And so we really look at precision medicine as kind of the ferry that goes across the water from all of these different biomarker testing and all of the different tests and things that kind of make up the pieces to put together a treatment plan. So the genetic testing, the DNA, the RNA testing that we've been kind of talking about is a piece of that. Sometimes there's other molecular tests that we may do there's a test called immunohistochemistry. We look at protein expression on the cancer cells. HER2 is a very common one that is tested in a lot of solid tumors now. That may be one that you've heard of. If you have a hematologic cancer, we do a lot of different FISH testing or other type of looking at the changes in the chromosomes. So that is one of the things that we consider. Most importantly, your own story, your own clinical history, your goals of treatment, and then also other things like the pathology. So what type of cancer you have, the imaging, all of that we consider in your narrative and put it together in our clinical consult to then help to provide kind of a synthesized menu for your treatment team to consider on-label therapy options, off-label therapy options, clinical trial options, prognostic evidence. So that's high risk, low risk. Is there something we can learn about the cancer from all of this information? Risk mitigation and the treatment optimization. That's how your body is going to break down or activate a cancer drug. And then if hereditary genes may be involved in the process. And so kind of putting all that together, we create this clinical consult that goes into the electronic medical record that then your treatment team can have whenever, as a piece of the information, whenever they are visiting with you and you're making treatment decisions. And so this is really kind of our process that our team utilizes. Once a genetic test looking at the tumor or looking at how your body may be breaking down or activating a drug is ordered by your medical team, our team will then receive that genetic result. And then we have the test information that gets entered into our data management site. And we will then go through the process that I showed on the last slide, where we will look at your narrative and put these genetic results in context. And then that information is then shared through the electronic medical record so that when you meet with your physician and your medical team, they can incorporate that information into that discussion. One of the reasons that we get this data entered into our data management site is that it does help us with clinical trial enrollment. So whenever we open a new targeted therapy clinical trial, we're able to go back and look at people who have a particular genetic alteration and see if you might be eligible for a clinical trial. The other way that we have used it in the past is if we have a new drug that gets FDA approved that was not before for a particular genetic alteration, we can go into that database and see if there are patients that now may qualify for a new on-label therapy. And we've done both of that. Our team kind of plays a little bit more or a little we collaborate with the clinical trials group in terms of trying to match for clinical trials a lot. And so, who are these people that are actually doing all of these different steps? And this is where I would like to let Paige Parkinson introduce herself and Juliana as our precision medicine associates and what they do. And then I'll tell you what our faculty does.
Hi, everybody. Good morning. My name is Paige Parkinson. I work very closely with Dr. Wacko, Dr. Kevin Hicks, Dr. Teresa Ho, and Dr. Todd Nepper. I also work very closely with Dr. Juliana Balu. We both are the precision medicine associates. So what we do is we help out all the faculty as much as we can in whatever areas that we can. One of the best things about our job, and I will speak for both me and Juliana because we discussed it previously, but we love the amount of patients that we see and we love the diversity of our patients. It's really great because on our end, I feel like when people hear personalized medicine or precision medicine, they kind of think like, oh, this is everything on the back end, and there's not much patient care involved. However, I think that what a lot of people don't see is that we really, really care for our cases and our patients. We kind of present everything to the faculty as much as and as best as we can to them. And then they kind of go from there and create the consults. But I think, like I said, a lot of people don't really kind of think of the patient care aspect, but I would say for sure that we kind of wrap everything up and we get to know our patients as much as the clinical level as the nurses and the medical team themselves. So that's one of the best parts about our job. So yeah.
Thank you. And so we have Paige and Juliana who help with a lot of our behind the scenes and data management, including creating some of the lists for our molecular tumor boards that I'll mention on the next slide. In addition, we have four faculty members, Dr. Kevin Hicks, Dr. Teresa Ho, Dr. Todd Nepper, and myself. All of us are actually doctors of pharmacy, and Dr. Hicks is a PharmD PhD. We are in the pathology department, so that's a little bit different. But I started at Moffitt back in 2014, and have watched precision medicine really grow from having some small places in therapy to really now being part of the standard of care of all of just about every different cancer. And so, because of that, we've divided up the different cancers between our whole group. That we have some individuals that focus on thoracic, pancreatic, colon, breast. Dr. Nepper has really carved out a very, very nice role in looking at the hematologic malignancies, the myeloid and the lymphoid cancers. And as I mentioned before, I have the privilege of working with a lot of rare tumors in addition to the gynecologic cancers, neuro-oncology, some of the GI and some of the genitourinary ones. So we're really specialized in the particular cancers in which we work. Um, and one of the things, the other big things that our group does kind of behind the scenes is that we lead and participate in multiple different tumor boards at Moffitt, including molecular tumor boards, where we have some cancer-focused ones. So we have a weekly molecular tumor board that is led by Dr. Nepper that is focused on the hematologic cancers. We have one that is focused on the solid tumors that we see. Dr. Hicks has created a very successful initiative with the thoracic molecular tumor board, where all the patients with thoracic cancers that are seen each week are reviewed for the clinical trials that we have available. We're doing that now with the gastrointestinal cancers, and are soon to roll that out with our breast cancers, our breast cancer population. And then we also have a monthly gynecologic molecular tumor board that I work with the gyn-onc team. And so we also have done outreach for several years where we work collaboratively with a memorial hospital for both treatment and educational purposes. You may have heard the term molecular tumor board before. This is an adjunct to the multidisciplinary tumor boards. We also participate in several multidisciplinary tumor boards as well. But the molecular tumor boards, again, have different purposes, and we've really tried to be flexible and consider the needs of each one of the groups that we work with and how we can create a solution through these different molecular tumor board lists where we, again, look at maybe some more complex cases or cases where we just need some additional information. These meetings are typically attended by our team or members of our team, as well as members of the clinical team related to the cancers being discussed. The molecular pathology team that is involved in actually doing the next generation sequencing and interpreting that to tell us what genetic alterations are there and if they're important. And then the clinical trials group as well is involved with a lot of these discussions. So they are multidisciplinary and really individualized for the different needs of each individual group. And so I think just as kind of a takeaway as we wrap up, how do you get a precision medicine consult? We really go through your medical team. So the genetic test must be ordered by your physician and your team. Our group does interpret both our inpatient or our in-house testing that is done. We call it the Moffitt Star assay, and there's several different hematologic assays that we do in-house. And then there's also some external companies as well, Foundation Medicine, Guardant, and Caris, as well as others that we also will interpret. Um, and so also, if you've had previous testing, please, please, please make sure that you tell your provider of any prior genetic testing that was done. If you have a copy of those results, that's great. However, even if you know where the test was done, so what physician or physician's office it was done through, or what company it was done through, if it was done through one of a different outside company, and we can help make sure that we get those results because that's an important piece of your care as well, and a piece of what we try to do. And so I thought we would just finish up. I think Paige, you kind of shared your comments earlier, but what I love about working in precision medicine at Moffitt, if there did you have any additional comments?
No, I was just gonna say, like, I know precision medicine, right? Like, a lot of people think, oh, it's just science, we're behind the scenes, but I really do feel like we care for our patients just as close as the medical team that everybody sees in clinic does. So that was just one of my main points.
Thanks. I absolutely love what I get to do. For me, it's absolutely amazing to see how far we've come in the 11 years that I've been at Moffitt. My dad died from lung cancer due to his service in the Navy back in 2000, and he was on an original docetaxel trial at that time. And to see how far we've come since those days is just so incredibly inspiring. And we're constantly identifying new ways to understand these cancers better so we can provide better treatment. And to me, it's just such a joy to really see that in action and to continue to push it forward, but also to care for. I'm so privileged to be a part of each individual patient's care in the way that I am. So it truly, truly is just something I'm so fortunate to do, and I absolutely love my job.